Hello everyone. Welcome to today's session where we explore the antibiotic linezolid, commonly known by its brand name, Zyvox. As always, remember that this discussion is for educational purposes only. For health-related inquiries or issues, consulting with a healthcare professional is crucial. Description: Linezolid, marketed under the brand name Zyvox, is an oral and intravenous antibiotic that belongs to a class of medications known as oxazolidinones. It is designed to treat various types of bacterial infections, including pneumonia, skin infections, and some types of multi-drug-resistant tuberculosis. Its mechanism involves inhibiting protein synthesis in bacteria, which effectively stops their growth. Linezolid is particularly useful for treating infections caused by gram-positive bacteria, including methicillin-resistant Staphylococcus aureus, MRSA, and vancomycin-resistant enterococci, VRE. Due to its potency and broad spectrum of action, linezolid is often reserved for severe infections or those that are resistant to other antibiotics. Warnings: Linezolid should be used cautiously, as it comes with significant potential risks. It is not suitable for patients with certain medical conditions such as uncontrolled high blood pressure, a history of seizures, or severe liver problems. It should also be used with caution in patients taking medications that can increase blood pressure or those who are on antidepressants that affect serotonin levels, due to the risk of serotonin syndrome. Before taking this medicine. Before starting treatment with linezolid, inform your healthcare provider if you have any allergies, especially to antibiotics. Patients with a history of bone marrow suppression, blood disorders, or severe liver or kidney disease should discuss the risks and benefits with their doctor. It's also important to tell your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding. Due to the potential for serious side effects, regular monitoring by your healthcare provider is recommended. Side effects: Linezolid can cause a range of side effects, some of which can be severe. Common side effects include diarrhea, nausea, headache, and changes in taste. More serious side effects may include lactic acidosis, a serious metabolic complication, peripheral and optic neuropathy which can lead to vision problems and nerve damage if the medication is used for extended periods. There is also a risk of bone marrow suppression, which can lead to anemia, low white blood cell counts, and reduced platelets. Immediate medical attention is required if symptoms such as unusual bruising or bleeding, persistent sore throat, fever, or vision changes occur. Interactions: Linezolid can interact with several other drugs, particularly those that affect serotonin levels in the brain, such as SSRIs, SNRIs, and MAO inhibitors. Combining these medications can lead to a potentially life-threatening condition known as serotonin syndrome. Symptoms include confusion, hallucination, increased heart rate, fever, excessive sweating, shivering or shaking, blurred vision, muscle spasm or stiffness, tremor, incoordination, stomach cramp, nausea, vomiting, and diarrhea. Always inform your doctor about all medications and supplements you are taking before starting linezolid. Dosage: The appropriate dosage of linezolid can vary based on the type of infection and the patient's medical condition. Typically, the adult dosage for oral or intravenous administration is 600 mg every 12 hours for 10 to 14 days. Your doctor will determine the exact duration and frequency based on your specific condition. It's crucial to adhere strictly to the prescribed dosage and not to discontinue the medication even if symptoms improve without consulting your healthcare provider. Avoid: While taking linezolid, patients should avoid tyramine-rich foods such as aged cheeses, smoked or cured meats, and some types of beer, as linezolid can interact with tyramine to increase blood pressure significantly. Also, patients should avoid excessive sunlight or tanning beds, as linezolid can increase sun sensitivity. FAQ: A common question about linezolid concerns its use in children. Linezolid is approved for use in pediatric patients, but the safety and effectiveness can vary depending on the child's age and the type of infection. Always consult with a pediatric healthcare provider for advice specific to your child. Closing: Thank you for joining today's educational session on linezolid. Remember, while this information is meant to inform, it should never replace the advice of a medical professional. If you have any questions or if you're considering this medication, please consult your healthcare provider.